Now, the newest trend in dentistry, which is replacing missing teeth with dental implants. You're a big fan of this.
Yes.
Denture wearers. What are their options? So if a denture wearer goes into your practice, what are the different options?
So, you know, Randy, the first option would be for the person to have 2 dental implants, and you get a full set of teeth that can be snapped right on to those 2 implants. So kind of a snap-off, snap-on type thing. But it's excellent for patients because they don't have to, you know, deal with when they're talking, their denture's moving, when they're even doing simple things like coughing or yawning or, you know, anything like that, you know, daily life things. These 2 implants allow them to actually be able to smile and talk and have confidence. And it's something so simple that all these denture wearers, they don't know that we can do that for them. So that's something great that we have to offer. So the next level up after 2 implants is to have 4 implants. And so 4 implants is excellent. It acts kind of like, you know, 4 legs on a table. So it gives a complete arch of teeth even more stability. So it allows people to eat carrots and meats and salads. You know, I have patients come to me, you know, I had a patient just the other day and she was like, I'm just tired of eating mashed potatoes.
Is that right? Okay.
Yeah, and so she wanted to have, you know, healthier food, and so it allows people to actually eat better, and we see people lose weight after having dental implants placed. You know, you'd think the opposite because now they can eat all these new foods, but it allows you to eat healthier things as well. So that's the next level would be to have 4 implants. And with that, you know, sometimes with 4 implants, you can have that full arch of teeth that's fixed, so they don't have to take it in and out. And other times, you know, with 4 implants, it can be something that they do take in and out.
Okay.
So there's 2 ways. And then the last category would be 6 implants, and, you know, that's the best in that it makes people feel like they have their real teeth again. You know, it makes.
So they don't come in and out.
Nope, they stay right in place. The only time it is removed is if they come to the dentist, and you know, these people feel like they have their 3rd set of teeth because they come in for their cleanings just like you and I. We, you know, just like a regular dental patient. They come every 6 months. We clean their implants, and we clean their gums, and we do an oral cancer screening. We make sure everything looks good. So it's. You know, there's many different options for people that have dentures out there and for people headed to dentures.